The advice and opinions expressed by Dr. 𝗵𝗃𝗃 and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen 𝗵𝗃𝗃 is
Dr. Doreen is an expert in autism.
Doreen 𝗵𝗃𝗃.
Dr. 𝗵𝗃𝗃.
Dr. Doreen 𝗵𝗃𝗃.
Dr. Doreen 𝗵𝗃𝗃 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Dr. 𝗵𝗃𝗃, I watched you on WFSB this morning because you've been doing a lot of press, and I'm reaching out to you for recommendations or suggestions for my 9-year-old autistic granddaughter. She was diagnosed between 1 to 2 years old. It has been a very, very trying on my daughter, who has had autistic teachers come to her house for the last 7 years. The problem is that almost all of these quote-unquote teachers are really not educated enough in the treatment of autism. She is very nonverbal still at 9 years, and only one-word answers, please help.
Yes, so thank you for writing in about that, and this is a difficult situation. I think, when you refer to, teachers coming into the house, I think you might be having behavioral therapists, BTs, behavioral technicians coming in. I assume, because that's pretty much the service that occurs in homes. I think what you definitely want to do is make sure that there's a supervisor overseeing the overall treatment. Supervisors, BTs, depending on the state, behavior technicians are only required by law to have a high school education, as well as around 45 hours of training, which some of it is class time, some of it is practicum. There's an observation and practical training period. It depends on the actual credentials of the BTs. Some BTs are called registered behavior technicians. That means they've definitely passed the exam, which again is still not a lot of training, but it is adequate, because they are overseen by a board-certified behavior analyst who's either a master's or doctoral level. Now, unfortunately, so that's your supervisor. Your supervisor is either a master's or a doctoral level behavior analyst, BCBA, board-certified behavior analyst. And, you need to talk to your daughter and make sure that the company that she's using, who provides these BTs, have a supervisor, and that the supervisor has frequent contact and provides oversight and training for the behavior technicians. Because, without the supervision, BTs could be doing basically anything or nothing, and you are wasting time. So I think that's very important, to make sure you have adequate supervision. I want to also say, two other thoughts for you to consider. It's a long period of time if she was diagnosed around 2 and she's 9 now, and for many, many years has been getting therapy. So that makes me question if the quality of the therapy was good and if the intensity was high. Because when you start at, let's say, 2 years old or something, you should be doing pretty intensive therapy, like 25, 30, 35, 40 hours a week of therapy through these behavior technicians. So, and generally speaking, you don't go on 7 years without having gained something. So if there isn't significant progress happening, not only would you or the parent would stop, but your payer, your health insurance won't go on without showing adequate progress. So I'm not quite sure what happened there, and you want to make sure you have high quality and a good enough program. Now that she's 9, it's a little different. The program would consist more of the specific skills that she needs, not every skill, but very, very specific, and it'll be very, very difficult to get access to intensive therapy. So at a 9-year-old, you're probably in school, which means she's probably in a special education program, And then maybe you can get something like 2 hours a day after that, which is 10 hours, which isn't bad, honestly, for age 9. But again, the content matters. So like if she has challenging behaviors, they're going to want to deal with that. If she has language deficits, like you mentioned, they're going to want to really focus on language. She might need adaptive skills like, dressing herself, getting ready, feeding herself, whatever those things are. So the content is very important. The supervisor determines that content by analyzing and evaluating your granddaughter. The last comment, though, that I want to make is don't be, just because they're young, don't be biased by that, because some of the BTs, honestly, when they come in, you're like, oh my God, this guy looks like he's 12 years old, but they're actually amazing and they're very talented. And Shannon, I'm sure you have stories about that. I just don't want to underestimate some really, really good and talented BTs that are out there.
Yeah. I mean, we've talked before endlessly about what are good signs of ABA. And I think that one of the good signs about ABA that we've discussed before is that the child is never wrong. And that, if what's being done isn't working, good ABA professionals change it up and do all different kinds of things. And they make it so fun and they make it so fair. I worry that, we all set the bar of where success is in a different area. And it sounds like this 9-year-old granddaughter has some pretty significant challenges and is still nonverbal after all this time. I feel like it would be unconscionable not to mention that not every person on the autism spectrum gets to vocal communication. And that I hope that this grandma understands that that is not going to be everybody's path. But certainly, we would want to see progress in all kinds of different things in order to determine that it's not. Because it's so hard to explain to somebody the differences between what something what does it actually look like, to pin it down so that somebody could see it without ever having seen it before. But that's why I always go back to your comment about it has to be fair. But it has to be fair and there has to be progress for the individual. So I hope that this grandma gets to that.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.